Mask mandates and other pandemic restrictions continue to ease up all across the country. Many parents now wonder how soon can they expect a vaccine to be authorized for children under 5. All right, here to discuss this, we got Dr. Campbell. He's a professor at UCSF School of Medicine. Dr. Campbell, it's a pleasure to have you, sir. It's been a while. Good to see you.
It's good to see you. Thank you for having me on. I'm honored to be here.
All right, pleasure is all ours, sir. So why are we still waiting for the FDA to approve vaccines for kids under 5 years old? What's the holdup there?
So first thing, thank you again for having me on. The problem is this, is that for 5 and up, it's totally approved. But what they were doing in the study is they've been trying to figure out what it's like for dosing of the drug, the vaccine for under 2 and 2 to 4. And what they found is actually for the kids who are under 2 with the 2 doses, and it's reduced dose, about a third of the adult dosing, that then they have the response was great for 2 and under. But for those kids who are into the 2 to 4 to 5 range, it was not as good. So what has happened now is they've extended the trial out to see whether or not they need to do 3 doses in children to get the same response. And once they do that, they'll be able to present the data to the FDA and go through the whole emergency use authorization, which they did for all the other things. So it is a question of making sure it's safe and that it's not ready yet for prime time. It will be, but it's not ready for prime time yet.
Yeah, Dr. Campbell, can you see how some parents would be hesitant, right? You tell parents, get your child vaccinated. Kids under 11 years old, they do so, and then we find out that it's not enough. Can you talk about that and how you can ease some of their worries now?
So let's talk about the vaccine is incredibly effective. So it is now, instead of, you get 3, and you're boosted and you're vaccinated and you're fine. Now, about 65% of the country is doubly vaccinated, about 30 to 35% are triply vaccinated, and it's safe actually 5 and up. It's pretty safe to vaccinate children at that age. That's been tested. They've done it on millions of children, and that's safe. So it's really this lower age group, and there's a lot of stress among the parents of the very young about when to do it, what to do, and I think eventually they will get to the point. I mean, this is now March, and they say that in April into May they'll have that, because what they had to do is instead of testing 2 doses at the lower dose, they had to test 3, and they have to see what the efficacy is like in that age group. It will be safe and it will come through, but it's been safe and there's been no side effects. And think about this: if you're vaccinated in February 2022, you have a 41%. If you're not vaccinated, you have a 41%, 41 times the risk of dying than if you're unvaccinated. So that means if you're vaccinated, you're protected, and if you're unvaccinated, you have a 41 times the number of chances of dying. So you want to be vaccinated and safe.
Wow. Dr. Campbell, my question next for you is, do you think that the easing of restrictions are in line with science and what we're seeing in terms of the numbers, the fact that there isn't a vaccine for children under 5, the vaccine being, I guess, replanned or rethought out in terms of another dosing for kids under 11, but yet we're seeing schools easing up on mask mandates. Some already have.
I think the first thing is, where are we? We're in a much better place than we were months ago. So before the Delta wave, before the Omicron wave, 90% of the samples now, 99% of the United States are Omicron. The Omicron instance is coming down. There's about 50,000 cases a day across the United States, but we're kind of coming up on this milestone. Remember this, there's still about 1,800 to 2,000 people dying a day. So that's still a lot of people. So what they did with the changing of the restrictions was, instead of mandating things for everyone, they decided that they would actually then give an option for parents to decide what they should do. And really, it still is a dangerous time for, if you're immunosuppressed, you're very young, if you have older people in the house, and they're not vaccinated, that could still be a problem. So it is going to be an individual decision about this. So if you have younger kids, maybe you should do it if you have immune suppressed people in the family who have not, responded as well to the vaccine, or they're at risk, or they're unvaccinated. So it is going to be a change in the way we think about this, because we're kind of moving into a phase where there's a lot less people. I mean, right now there's roughly, there's about 30,000 people in the hospital. In my hospital, we have only one patient in the ICU, maybe seven total. We were up to 70 or so at one point. So it is a lot better space than we were. And the more we get people vaccinated, so the message about vaccinating still has to resound. Get that third booster, get two shots and a booster. Make sure you get all that done so you could be protected. And the very young, it's an individual decision. If you want to. Now, what they did is they said 70% of people don't have to wear masks. But that means that there's still 30% of people who they think should wear masks, and that's the unvaccinated. And you have to decide if you're going into a big place where you don't know what the vaccination status is of the people there. I'm going to wear a mask if I go into a big place to do that. I was just on a plane. I wore a mask, and we're still going to do that because it's a little bit of a cramped space to do it. So it'll be individual decision as opposed to putting that on. But it's going to be a time that's going to be quite stressful for parents and adults alike.
Yeah. Well, talk to those multi-generational houses that so many of us live in, right? You have the two most vulnerable groups living together in a lot of instances. You have the immunocompromised, the elderly, then you also have young folks as well. So how can families protect themselves if that's the structure of their household?
So the first thing is the people who are older generation immune suppressed should be vaccinated by two and then boosted across the board. That will reduce the chance of any problems for them. And then as the children, when they hit the age 5, they should all be vaccinated. So that will take care of most of the older children. Then we'll wait for what's going to happen with the younger children. And you have to be safe and very thoughtful with who your kids play with, who they're with, and what goes on at school. So the other thing is that they they left the door open, that if the incident starts to go up, because we've been in this place before. We've been in this place where, we got rid of the first wave, then here comes Delta. You're like, wow, that was amazing. Then that went away, and then Omicron came after that. So we've been in this space before, and we have to be vigilant. So we have to know what the test positivity rate right now is, about 4%. There were times it was 50 or 60%, even like a month or two ago. So if the test positivity rate goes up, the incidence of infection, if there's a new variant, because there's going to be a new variant,
Yeah.
that I think we can see that already. You have the variant A, and then Delta, and then you have Omicron. There'll be another variant, and there's several variants of Omicron going on now. So the thing you'll have to do is what's going on in your area is, like, in where I live, the vaccination rate is 85, 90%, which is great. There is still some mass restrictions when you go on public transportation, but they're probably going to ease some of those things as we go along. But we have to look at the case positivity rate in your area, because there's some areas that are still being stretched. And just remember, there are 2,000 people dying a day.
Yeah.
That is a lot. That's a 9/11 every day. It's still happening.
Yeah, which is very frightening. I guess my last question for you, Dr. Campbell, because you're a busy man. I know you got to go, but I want to squeeze this one in. It piggybacks off of the immunocompromised folks, right? How should they interact with their grandbabies who are under 5 years old, who can't be vaccinated? Should that immunocompromised person wear a mask when they're interacting with young children who aren't eligible for a vaccine yet?
It really depends. I think if the child is actually in the house all the time, the child going to daycare, what's going on with daycare? Or is the daycare, if they have good ventilation, and are they really proper, hand hygiene, making sure that the place is a safe place, and there are no outbreaks in the pre-K or the school that the kid is in. So if that's the case, then you may be a little bit more relaxed. But if you're in an area where there's a big incidence of the infection, and there's outbreaks in the schools, then you have to then go back to the more cautious thing of masking and being very careful and making sure that you don't expose the young children to the possible infection. But if the older folks are vaccinated, then I think that will take a lot of relief off of how they interact with their children, because then they know that they're relatively well protected in terms of interacting with younger members of the family.
All right. Dr. Andre Campbell, always a pleasure. And fun fact about Dr. Campbell, he also goes by Dr. Dre as well.
Thank you so much.
Pleasure
Great being with you.
having you, sir. Have a good one. When BNC Live returns.